Hello everyone, I'm Dr. Deeksha from Department of Obstetrics and Gynaecology at Narayana Health. Today we are with Dr. Lavanya Kiran, who is a senior consultant, infertility specialist and a robotic surgeon at Narayana Health. So, a pregnancy is always a beautiful part of a woman's life. But sometimes some women face a problem in pregnancy called as gestational diabetes mellitus. So today Madam will solve some of our doubts from gestational diabetes mellitus. So ma'am, what is gestational diabetes mellitus?
Like you mentioned, pregnancy is a beautiful journey, and we want it to be that way till we send you home with the bundle of joy. But then, it being beautiful through the path, sometimes it can be a bane as well. So, here, whenever we have seen that women are progressing towards their career, a lot of people are postponing their pregnancies for several reasons. And with this comes our bane, because with an increase in the reproductive age group or the marriage age that you have changed, she can end up being diabetic. So, what does this mean? Whenever you're diagnosed to have high blood sugars in pregnancy, we call this as a gestational diabetes. That is when she becomes diabetic during the process of pregnancy, or in pregnancy your sugar starts getting elevated. We call it as gestational diabetes.
Okay. So madam, what are the risk factors for GDM or gestational diabetes mellitus?
So the other way of taking it is, who is more prone to become diabetic in pregnancy? Like I mentioned, it's the increasing age of a pregnancy. So if you delay your pregnancy and the age increases, that's a risk factor. If you have a family history, then again you have a risk factor of developing diabetes during pregnancy. If you've had diabetes in your previous pregnancy, that means I would say 50 to 60%, or rather, I wouldn't mind saying even 70%, that you would become diabetic again during your pregnancy. If you're a polycystic ovary patient, then again you're prone to diabetes. Obesity is one of the factors. Remember, with the changing trend in the lifestyle, people are surrendering themselves to alcohol, smoking, all these things become an aggravating factors to leading into diabetes, and lot of symptoms, lot of unhappiness scenario in this beautiful journey of pregnancy, and it can be really devastating for you as well.
So madam, what is causing this gestational diabetes? Why do we see it?
Here, like I mentioned, we are talking about gestational diabetes. That means we're talking about diabetes which comes in pregnancy. In pregnancy, it's already a hypercoagulable state where a lot of alterations in the blood is happening, and a lot of hormonal changes are happening. Because of these hormones, there's a lot of interface between the insulin and the pregnancy hormones which are produced. So when there's a little episode happening inside the body, and like I mentioned, all the risk factors which is already presenting leads to a variation in the blood sugar levels during pregnancy, and this can lead into diabetic status during the process of pregnancy, and sometimes can be really harmful.
So, madam, one of our most common doubts of our patient is, if she is diabetic in pregnancy, will she continue to be diabetic all her life?
No,
What's
certainly not. You don't have to get worried, because if you're diabetes, like I mentioned, if you approach your doctor quickly, we can identify. We have lot of treatment modalities how to make your sugars come under control and make sure, like I mentioned, to send you home with a bundle of joy. So most of the times, I would say 80% of them do wonderfully well if you are under strict protocol and your strict observation of your obstetrician, and they're going to help you go home healthy with a healthy baby. If you're not following it up, so we always follow our patients post delivery as well up to 6 weeks to make sure that the sugar levels have reduced. Quite a few of them, like I said, normalize on their blood sugar with the variation and changes in the lifestyle modalities. But quite a few, almost I would say 15 to 20% of them, later part can end up being a little diabetic. But with the lifestyle changes, I would say only few percent, maybe 5%, 5% of the people end up going to becoming a chronic diabetes.
okay? So, what are the complications of this gestational diabetes, ma'am? To the mother, what are the complications?
Yes, to the mother, what happens because her insulin is altering, her sugar levels are going high. You already know diabetes is not, though it is a sweet disease, but then it causes a lot of bitterness in our life. So, what happens with the alteration of these sugars? First of all, she can become obese because she's ending up binge eating, because there's a lot of alteration in her sugars happening as well. In the whole process, she ends up having a bigger baby because her diet is bad. She eats a lot of unhealthy things. She's binging. There's a lot of variation in the sugars happening. So they also end up having a little bigger babies. Of course, we all like to see chubby babies, but then we need to understand when this baby is coming out. It can be quite traumatic to the women as well. So this can also lead into a lot of blood loss during the process of delivery, lot of injuries to the maternal pelvic area as well. And like we say, PPH can be quite bad, where you end up going through an hysterectomy also if we cannot control the bleeding. But if you can control it, then it is good. Not only mother, it is also sometimes bad for the baby. The worst of the symptom that I don't like in a diabetic mother is stillborn babies. That's unexplained IBDs. What happens? Like I mentioned, there's no symptom at all. She would have finished her checkup today, and she doesn't perceive her movements in quite some time, and then patients fail to understand that fetal movement is a very important part of any pregnancy. So it's very important that you keep tracking the fetal movements. You need to keep a chart of the fetal movement. Like we say, from morning till night, you need to have 12 to 15 movements at least. So if you change your lifestyle and you keep monitoring the fetal movements, they do wonderfully well, and we can prevent this sudden deaths inside the uterus
Silent,
itself. Yes,
yes.
silent deaths can happen inside the uterus. We call it a stillborn. Intrauterine demises can happen. So if you are monitoring your fetal movements, then it is good. Otherwise, this IUDs, bigger babies also have lot of problems, because these babies can end up more in the ICU. The number of admissions to ICU is high. They can end up having higher jaundice levels, so they need treatment for a longer duration of time. And few babies again tend to become diabetic later. So it's very important that it's your reflection also goes on to the baby. Very important you keep your sugars under control.
So, madam, does this affect the mode of delivery? So,
Yes, like I mentioned, diabetic mothers will end up having very big babies. If the babies are big, then we cannot deliver her. Indian height, I would say, average is around 5.2 to 5.4. So anywhere around 3 to 3.5 kg baby is good to come. But if you are 5.2 and then you end up having a 4.2 or a 4.5 kg baby, how do you think I would be giving her a vaginal delivery? So we end up doing a cesarean section. Any surgical modality has its own complications. So again, surgery has its own complication, anesthesia effects, like I mentioned, postpartum hemorrhage, that this bleeding can be high, and it has got its own complications.
So how will a patient come to know she has this gestation diabetes? How do you diagnose?
So we do something called as a preconceptional counseling. Anytime that you decide that you want to conceive, make sure you approach, get your health checks done. Here at Narayana, we also have executive health checkup. We do preconceptional counseling as well, where we do your blood parameters. We make sure that your blood sugar level, not only the blood sugar levels, we also assess her hemoglobin, thyroid, make sure that she's fit to conceive again. And here we can diagnose that are you diabetic even before you become pregnant. We have several patients, because here at Narayana we are taking high risk pregnancies, where we deal with people with cardiac problems, diabetes, hypertension. Lot of associated medical conditions are treated here in the OBG department, because we work as a team. And here, once we analyze that she's already diabetic, we need to make sure that your sugar level comes down. Because if you end up having higher sugars and you conceive, because by the time you get to know you're pregnant, you already around 6 to 7 weeks time, your baby formation would have started. If you become pregnant while your sugars are high, you can end up having a lot of birth defects, cardiac problems, kidney problems can come up, and that's why it's very important that you get your blood sugars done. But it's very difficult to know during pregnancy for a patient per se, because you may end up having little increased frequency in urination, thirst, but any diabetic patient would be having, until unless
Pregnant
we,
patient
yes,
also.
yes. And it becomes very dicey, because you wouldn't know until we do an investigation. This is why when your doctor says do investigations, please go ahead, because we almost try to evaluate them at every trimester, because the first 3 months we try to evaluate. We also do a preconceptional investigation, like I mentioned. We repeat it at the 5th month. We also repeat it at the 7th month, because we still have time for your delivery and we can make a lot of corrections, and then this can be investigated and treated as well.
So, ma'am, how will you manage, or what advice would you give to a mother who has gestation diabetes?
I think I like the word how would you manage, because I'm very lucky to be here in this institute of Narayana Health City, where we have diabetologists right across us, and they are going to help you control your sugars very well. We have yoga therapist here who is going to help you modify your lifestyle, because it doesn't happen over a day. It is not just that I'm going to put you on medications, or my diabetologist is going to put you on medications and get your sugars under control. We need to modify our lifestyle. So when I say lifestyle modification, you need to remember it's not just the diet I'm talking about. It's both the diet and the exercise which needs to be working, and it needs to go hand in hand. We always tell our patients, please eat smaller portions, eat 6 times a day. So your 3 meal is going to get divided into 6 times. So we say 3 meal and a 3 snack. And the other way of trying to say it, we always tell them eat every 2 to 3 hours once. But remember, you cannot go back home and say, I heard Dr. Lavanya speaking and she said 6 meal. Please remember, these are all smaller meals. So you cannot have bigger meals and 6 meal and you say you ended up becoming diabetic because of me. So remember, it has to be smaller portions and it has to be 6 times. And the best way of controlling again is you need to walk post each meal. So when you walk after every meal, your sugar gets digested. And with the exercises of the upper body, like I said, we have a yoga therapist who will keep teaching you exercises in order to make sure that the insulin secretions are higher. So your sugar levels are automatically going to come down. But if your diet is not helping, your yoga is not helping, your exercises are not helping, like I mentioned, we have our diabetologist who's going to help you. Sometimes works well with the medications. Several of the times we have no choices but to put you on insulin, but we are all a call across away where the sugars are monitored. They are with the trainers and they teach them how to take injections, how frequently it is monitored. Every level is being coordinated with the consultant and the training people who are always there with them.
So, what about exercise? So, do you advise exercise in all pregnancies or?
See, exercise is good, but then pregnancy has its own complications, like I mentioned. Sometimes they have placenta very low lying, or they've had frequent abortions, mid trimester abortions. So we always take a detailed history, and then we understand what is the kind of exercises that they can be doing. So that is why I said we work here as a team, and we are in coordination with the yoga therapist who will teach you what is the right kind of exercise that you can do. Worst of the scenario, if she's on a very high risk patient, she cannot get out of her bed, or she has a cervical incompetence and she cannot do a lot of exercise, then we teach her upper body exercise where she can be sitting and doing all these exercises, where she can do her leg movements, hand movements, stretches while she's sitting down. So we have all kinds of exercise. We tailor make it to each patient so that each person has a different category and a different kind of exercise, different diet, and different medications to give to each person.
So, will this insulin harm the baby? So, some patients, like you said, receive insulin. So, will it harm the baby?
Certainly not. Certainly not. That's only because insulin doesn't cross the placenta. Placenta is something which is a barrier preventing all the bad medications, because whatever the doctor says is all good medications, but you end up taking few medications which filters out and make sure it doesn't pass on to the baby. So you don't have to get worried at all.
So, and what about the future health risks to the mother or to the baby, ma'am?
Like I said, baby, sometimes they end up with NICU, but the recovery rate is very good. We have wonderful pediatrician, we have a wonderful NICU team where they take care of your baby. Like I mentioned, jaundice can be high. Sometimes the sugar of the baby can be altering so much, so we have modalities to treat and help the baby. But me being an obstetrician, I care for the women who come to me. So I make sure I monitor them for continuous 6 weeks, call them at intervals, keep checking their sugars. We continue to personally monitor that they continue to do the lifestyle modification of their diet and exercise which goes. But most of the time, once the baby comes out, we have seen several times that how our sugar drops down automatically because the baby's out, the placenta is out, all the hormones almost comes down very quickly. A lot of people who have been on insulin while pregnancy, the baby comes out and next day we see that her sugar levels are almost normal. So they return to normal quite well, but it's mandatory. Like I mentioned, 6 weeks is monitored. Very few of them, around 1 to 5%, can become a chronic diabetes, but monitoring is very important.
And what about later on in life, ma'am? Maybe say 10 to 20 years? So,
Yes, around 5% people can become diabetic, but the lifestyle modification which you started on during pregnancy, make sure you continue. continue to have a healthy diet, continue to do healthy exercise. There is no uh, perfect diet for a perfect person, or there's no this is the right exercise that you need to be doing. Make sure you lead a healthy life where at least 30 minutes of exercise is done everyday basis, more of vegetables, more of fruits, cut down on your unnecessary calories, especially all the carbonated drinks that is going on, like I mentioned, alcohol, smoking. So let's not follow the westernized people too much. Let's come back to our Indian culture of yoga, good kind of foods, and our native fruits and the native uh,
Locally grown.
grains that we grow. All those things are really good. So if a good lifestyle modification is managed, and like I mentioned, small frequent meals can be followed out even
Protein
post
rich,
pregnancy, and protein rich diet really helps them. And make sure that at least if it's in the gene you're going to get, but then you can prevent it and postpone you becoming diabetic a little later. So I think if you continue to have a good lifestyle, you don't have to see us.
Okay, thank you so much, ma'am, for helping us with
I
this
hope
topic.
this will help you and help you stay healthy as well. Thank you so much.
Thank you.